Hello friend, how are you? Hope you are well. I am also well. Today we discuss about diabetes mellitus. Diabetes mellitus or DM is a group of disease characterized by high level of blood glucose level resulting from defect of insulin production, insulin action or both. According to World Health Organization, in worldwide 422 million people have diabetes and in an approx 1.5 million patients were dead in every year. For better understanding about diabetes mellitus, it is important to know about pancreas. Pancreas is an organ in our body located in abdomen. It has two functions, exocrine secretion and endocrine secretion. In exocrine secretion, its main function digestion. In endocrine secretion, pancreas has four types of cells. 15 to 20% cell alpha cell that synthesize and secreted glucagon. 70 to 80% cell are beta cell that synthesize and secreted insulin. 1 to 8% cell are delta cell that synthesize and secreted gastrin and somatostatin. 1 to 2% cell are F cell that synthesize and secreted pancreatic polypeptide that decrease food absorption capacity in gastrointestinal tract. Glucagon and insulin, they both are regulator. They control our blood glucose level. Glucagon increase and insulin decrease our blood glucose level. Insulin is a polypeptide hormone. It is secreted from beta cell of islets of Langerhans of pancreas. It is protein nature. It has two chain, alpha chain and beta chain. They connected each other by disulfide bond. It secreted by two way, low secretion during fasting and high secretion after eating. Type of diabetes mellitus. Number 1, type 1 diabetes mellitus. Number 2, type 2 diabetes mellitus. Number 3, gestational diabetes mellitus. Type 1 diabetes mellitus, T1DM, also called insulin dependent diabetes mellitus or juvenile diabetes. 5 to 10% of total diabetes mellitus are included this type of diabetes. It is a chronic autoimmune disease in which immune system attack or destroy beta cell of pancreas so that insulin production are very little or stop. Tropically it is appear in adolescence and childhood. It cause genetic and some environmental factor trigger the immune response. Symptom. Its symptom is high level of blood sugar level, polydipsia, that means increased thirsty, polyphagia, that means increased hungriness, polyuria, that means frequent urination, and fatigue, weight loss, blurred vision and lack of energy. Type 2 diabetes mellitus, T2DM, also called non-insulin dependent diabetes mellitus. 90 to 95% of total cases are included type 2 diabetes mellitus. The disease is due to decreased biological response to insulin, otherwise called insulin resistance. So there is a relative insulin deficiency. Pathophysiological defect of type 2 diabetes mellitus. Number 1, there is a peripheral resistance to insulin, especially muscle cell. Number 2, increased production of glucose by liver cell. Number 3, defect insulin secretion by the beta cell. Symptom: polyphagia, polydipsia, polyuria, weight loss, fatigue, blurred vision, lack of energy, immune suppressed, etc. Gestational diabetes mellitus, a form of high blood sugar level of a pregnant woman. Those who develop gestational diabetes are higher risk developing type 2 diabetes mellitus in future. In most cases, there are no symptom. Diagnosis. Number 1, fasting blood sugar test. According to data of Global Health Observatory, 70 to 100 mg per dl, it is the normal fasting blood sugar level. If it is crossed 126, then it is diagnosis as diabetes. Number 2, OGTT, oral glucose tolerance test. It is a standard dose. 75 gram of glucose is ingested by mouth and check the blood sugar level 2 hours later. Number 3. Glycosylated hemoglobin test. It is the best indexed long-term control of blood glucose level is measurement of glycated hemoglobin. Number 4. Urine analysis. In the condition of high blood sugar level, urine condition is glycosuria, that means glucose present in urine, ketone bodiuria, microalbuminuria, etc. Diabetes long-term effect damage blood vessel which can lead to heart attack, stroke and problem with the kidney, eye, gum, feet and nervous system. Treatment. In type 1 diabetes mellitus, maintaining normal blood sugar level through regular monitoring, diet, exercise and insulin therapy. In type 2 diabetes mellitus, regular monitoring, diet, exercise, insulin therapy and some oral medication like metformin, miglitol, acarbose, etc. This content purpose is only awareness, education and more knowledge. You cannot treat yourself by this knowledge. If you do it, it is your responsibility. If you belong in this condition, you must go to take guideline of a doctor. Thank you.